Welcome to the deep dive. Today, we're jumping right into equine health, looking at something called equine dacryocystitis. Sounds complicated, maybe,
A little bit, yeah.
but it's actually pretty common and really important if you're around horses. We've gathered a stack of veterinary sources, and we're going to break it all down for you.
That's the plan.
Mm.
We want to demystify this condition. Basically, it's an inflammation, sometimes an infection, of the tear drainage system in horses.
Okay.
We'll look at what causes it, and there are quite a few things, what signs you should watch for, how vets figure it out, and, what treatments are available.
So it's more than just a simple blocked tear duct, then?
Oh, definitely. It's about understanding a really critical part of a horse's comfort and their overall health.
And it gets interesting, right? We'll see how even just a tear backup can cause big problems, from issues foals are born with to things like dental problems in adult horses.
Exactly. Lots of connections there.
So by the end of this, you'll have a really solid grasp on equine dacryocystitis. Ready to dive in?
Let's do it.
Okay, first things first. Equine dacryocystitis. What is it exactly?
So at its core, it's inflammation or infection of the nasolacrimal sac or the duct.
The tear duct system.
Right. Think of it like plumbing, basically.
Mm-hmm.
A natural drainage system that carries tears from the eye down into the nostril.
Okay.
When that system gets blocked or inflamed, the tears can't drain properly, they back up,
Mm-hmm.
and that fluid buildup can lead to infection, and then you get what vets call epiphora.
Epiphora, that's the tears spilling onto the face.
Exactly. That's the fancy term for it. Just tears running down the face because they have nowhere else to go.
So, like you said, a clogged drain. But for tears, what does this actual system, this plumbing, look like?
Yeah, good question. So tears start at these tiny openings called puncta. There's one in the upper eyelid, one in the lower.
Okay, I think I can picture those. Little dots.
Right. From the puncta, tears drain into small canals, then into the nasolacrimal sac, which, interestingly, is smaller in horses than some other animals.
Oh.
And finally, they go through the main tube, the nasolacrimal duct, which opens way down inside the nostril in the ventrolateral nasal cavity.
Wow, quite a journey for a tear.
It is. And that whole pathway needs to be clear. If there's an obstruction anywhere along there, tears just sit. They stagnate.
And stagnant fluid plus bacteria, that equals infection.
That's usually what happens. It creates the perfect environment for bacteria to multiply.
Got it. So the root cause is always some kind of blockage in that duct.
The primary predisposing factor, is always an obstruction. But what causes that obstruction? Well, that's where it gets really varied.
Okay, let's break that down. Starting with the young ones, foals. What causes it in them?
In foals, it's almost always congenital abnormalities, meaning they're just born with it.
Ah.
You usually spot the signs in the first maybe 2 to 6 months. Though sometimes if a foal's turned out after weaning, it might not be noticed until they're a year or two old.
And what kind of abnormalities are we talking about?
Well, the most common one is atresia of the nasal puncta. That's where the opening down in the nostril just isn't there. It's not fully formed, usually just on one side.
Okay.
Less often, you might see atresia of the lacrimal puncta. The little openings in the eyelids are missing. Or the whole duct itself might be underdeveloped, which is called a genesis.
Makes sense for foals.
Mm-hmm.
But then for adult horses, the causes are different. You said acquired.
Right. Acquired obstructions can happen anytime later in life.
Yeah.
And they're usually just on one side, too.
And the most common cause in adults is?
Surprisingly simple, actually.
Mm-hmm.
Inflammatory debris or mucus plugs.
It's gunk.
Pretty much. An accumulation of mucus, dead cells, inflammatory material,
Yeah.
it just builds up and blocks that narrow duct.
Okay. And horses being horses out in fields, I bet other things get in there too.
Oh, absolutely. Foreign bodies are really common. Bits of hay, seeds, dirt.
Plant material, yeah.
Exactly. That can easily get lodged in there.
Mm.
We also see blockages caused by trauma.
Like a kick or a fall.
Could be. Fractures of the facial bones near the duct, or even just a direct injury to the duct can cause scarring, strictures. Basically a narrowing of the tube.
Okay, that makes sense. What about infections or growths?
Yep, those two. Bacterial or fungal infections can cause the lining of the duct to swell up and close off.
Mm-hmm.
And then you have masses. Things like tumors, especially squamous cell carcinoma, or SCC, which is fairly common in horses, particularly older ones.
SCC.
Or even non-cancerous granulomas. These can press on the duct from the outside or sometimes grow inside it.
Granulomas? Like from parasites?
Sometimes, yeah. Habernomyces that's linked to stomach worms and flies can cause granulomas near the eye, particularly in warmer places with lots of flies.
Flies again, always causing trouble.
Tell me about it.
Are there any other causes that are maybe less obvious?
Definitely. Two important ones are dental disease.
Teeth? Really? How?
Yeah. An infection or an abscess at the root of a nearby tooth, the inflammation can actually push on or affect the nasolacrimal duct. It's surprisingly close.
Wow. Okay. And the other one?
Chronic sinusitis. Long-term inflammation in the sinuses can cause swelling inside the nasal cavity that blocks the duct's opening down there.
Huh. It really shows how interconnected everything in the head is.
It absolutely does. You might also see fibrosis, which is scarring, or even other parasites like the Thalassia, the eyeworm.
Fascinating range of causes. Are there specific risk factors that make a horse more likely to get this? Besides, flies and maybe age?
Well, yes. Certain coat colors, white, chestnut, palomino, especially with light skin around the eyes, seem predisposed to ocular SCC.
Ah, the cancer connection again.
Right. Which, as we said, can cause obstruction. So that's a risk factor for dacryocystitis indirectly.
Okay, so if you're looking at your horse, how do you know this won't be the issue? What are the telltale signs?
The finds mostly relate back to that blocked drainage and the inflammation it causes. The number one most consistent sign is epiphora.
The excessive tearing.
Exactly. Tears spilling over the lower lid, making that wet track down the face. That's the classic sign.
Does the discharge itself look different than normal tears?
It often does, yeah.
Ah.
It can become thick, cloudy, sometimes yellowish or greenish, containing pus, especially if there's a secondary infection.
Pus? So a sign of infection.
Definitely. And sometimes you might even see that thick, nasty discharge sort of reflexing, coming back out of those little puncta openings in the eyelids. You might also just see some mild redness of the conjunctiva.
Is the eyeball itself usually okay at first?
Generally, yes. The globe and the main conjunctiva aren't typically involved right at the start.
What eventually?
But because of the constant irritation from those stagnant tears and the almost inevitable secondary infection, you nearly always end up seeing conjunctivitis.
The redness and swelling of the pink bits.
Right. And what's often a clue is that this conjunctivitis might not respond well to standard antibiotic eye drops.
Because the underlying plumbing issue isn't fixed.
Precisely. If it goes on for a long time, this chronic dacryocystitis can lead to more widespread inflammation, involving the eyelids too, that's blepharoconjunctivitis, or even the cornea, which is keratoconjunctivitis.
Okay. What about, physical swelling or skin irritation?
Yes, you can see swelling. Sometimes it's right at the inner corner of the eye over where the lacrimal sac sits. Or you might notice subtle swelling along the path of the duct on the face. In really bad or chronic cases, an abscess can form that might even rupture and create a little draining hole on the face.
Ouch.
Yeah. And definitely, that constant wetness from the tears irritates the skin below the eye. You can get raw, inflamed, maybe stained brownish. We call that periocular dermatitis.
And the horse is obviously going to be bothered by all this.
Oh, absolutely. You'll likely see signs of pain or discomfort. Squinting is common, maybe rubbing the eye a lot, increased blinking.
Okay, so those are the signs. Now, how does a vet figure out for sure that it is dacryocystitis and what's causing it?
Diagnosis always starts with a really thorough ophthalmic exam.
Looking closely at the eye.
Yes, and crucially, ruling out other things that cause tearing. Like, is there a scratch on the cornea? Is it uveitis? Is there a piece of hay stuck under the eyelid? Those need to be ruled out first.
Makes sense. So after the basic eye check, what's next?
A very common first test is the fluorescein dye passage test. You might hear it called the Jones test.
The dye test, right. How does that work?
The vet touches a little strip with harmless orange fluorescein dye to the eye's surface. In a normal horse, that dye gets picked up by the tears and drains down the duct.
And you see it come out the nose?
Exactly. You should see the orange dye appearing at the nostril, usually within 5 to 15 minutes.
And if you don't?
If it doesn't show up or it takes way longer, that's a really strong sign that there's a blockage somewhere in that duct.
Okay, so the dye test points to a blockage. How do they then find out where it is and maybe even clear it?
That's where nasolacrimal duct flushing comes in. And it's neat because it's both diagnostic and therapeutic. Well, the most common way is retrograde flushing, from the nose up towards the eye. The vet passes a small, flexible catheter.
Like a little tube.
Yeah, like a tiny feeding tube or a special catheter, into the duct opening inside the horse's false nostril. Then they gently flush sterile saline solution. If the duct is open, you'll see the saline washing out through the puncta in the eyelids. Sometimes it makes quite a little fountain.
Oh, okay.
But if it's blocked, the fluid might meet resistance, or you might see pus and debris flushed back out the nose. That tells you there's a blockage, and sometimes the flushing itself clears it.
Ah, so it can fix simple plugs.
Exactly. You can also try normograde flushing from the eye down, but it's trickier because those eyelid puncta are tiny.
And if there's pus coming out,
Then you definitely want to collect a sample of that discharge for bacterial culture and sensitivity.
to find out which bacteria and which antibiotics work best.
Precisely. That guides the treatment effectively.
What if flushing doesn't work? Or if the vet thinks it's something more serious, like you mentioned, a fracture or a tumor?
Right. If simple flushing isn't resolving it, or if we suspect a structural problem, then we need imaging. Contrast radiography or dacryocystitis.
Whoa, say that again.
Yeah, dacryocystitis. Basically injecting a special dye that shows up on x-rays into the duct.
Okay.
Then you take x-rays, or even better, a CT scan. This lets you see the whole duct pathway outlined by the dye. You can pinpoint exactly where a blockage, a narrowing, a fracture, or a mass is located. CT gives amazing detail.
So imaging is key for the tricky cases.
Absolutely. And skull x-rays might be done specifically if a facial fracture is suspected.
Are there any other diagnostic tools vets might use?
Yes. Sometimes endoscopy at the nasal cavity is helpful. Using a small camera to look directly at the opening of the duct down in the nose and check the surrounding area.
See if there's swelling or a mass there.
Exactly. There are even microendoscopes now that can go into the duct itself.
Wow.
And of course, a thorough dental exam, maybe with dental x-rays, is really important if tooth root problems are suspected as the cause.
Right, checking that connection.
And for specific things like haberniomyces, granulomas, or suspected SEC, you might need lab tests. Scraping the granuloma or taking a biopsy for analysis under a microscope.
So a whole range of tools depending on what's suspected.
Definitely. It's about putting the pieces together.
Okay, so once the vet has figured out what's going on, what does treatment usually involve?
Well, it really depends entirely on the cause and how bad it is. For many simple blockages like those mucus plugs,
The gunk.
the gunk, nasolacrimal duct flushing is often the main treatment. It might need to be repeated, sometimes daily for a while, until the duct stays clear.
Makes sense. What about medications? Are eye drops usually involved?
Very often, yes. Topical antibiotic eye drops or ointments are standard practice to treat that secondary conjunctivitis and any infection present in the eye itself.
Okay.
If the infection seems more severe, or if there's an abscess, or maybe even signs the infection is spreading, then systemic antibiotics pills or injections are needed, ideally based on those culture results.
Right. Targeted treatment.
And anti-inflammatories are important too. Things like topical or systemic NSAIDs, bute or banamine, help reduce the pain and swelling.
Good point. Any other medications?
Sometimes topical corticosteroids are used for inflammation, but there's a big caution. Only if there's definitely no corneal ulcer. Steroids can make ulcers much worse.
Ah, critical point. Good to know.
And if surgery's been done to fix the duct, vets often prescribe systemic antibiotics for a week or 10 days afterwards, and sometimes flush antibiotic solutions through a stent if one was placed.
Okay, you mentioned stents. What if flushing alone just isn't keeping the duct open?
Yeah, for those stubborn cases, recurrent blockages, or if there's a stricture, a temporary stent can be really helpful.
What is a stent exactly?
It's just a small, flexible tube. After flushing the duct clear, the vet threads this tube into the duct to hold it open while things heal and the inflammation goes down.
How long does it stay in?
Usually for several weeks. It's often stitched carefully to the skin near the nose and the eye to keep it from falling out.
Clever. And then, for the really tough situations, congenital problems, severe trauma, masses, I guess surgery is the next step.
It often is, yes. Surgical intervention is needed for congenital atresia where the opening wasn't formed properly. The surgeon creates an opening, often placing a stent temporarily afterwards.
Okay.
For really persistent acquired blockages from bad trauma, severe scar tissue, or removing tumors or foreign bodies, surgery might be needed to repair or revise the duct.
And what if the duct is just too damaged to fix?
In those cases, there are salvage procedures, things like conjunctive orinostomy.
Another long word.
Yeah. It basically means creating a new drainage pathway. The surgeon makes a route for tears to drain directly from the conjunctival sac near the eye into the nasal cavity or sometimes a sinus.
How do they do that?
It often involves drilling a small hole through bone and placing a permanent or semi-permanent tube or stent. It's definitely more complex surgery done under general anesthesia. There are variations too, like canalicular anostomy or conjunctivosinostomy.
Wow. Okay. So pulling it all together, what's the long-term outlook for the horse?
Well, a big part of long-term success is treating the underlying cause. If it was dental disease, you have to fix the tooth. If it was a tumor, that needs addressing. Otherwise, the dacryocystitis will likely just come back.
Makes sense.
Supportive care helps too, protecting that irritated skin below the eye with some barrier cream, like petroleum jelly. And good fly control is always important around the eyes.
Right. And some cases need hospitalization, others are outpatient.
Exactly. Simple flushing can often be done outpatient. The surgical cases obviously require more intensive care and hospitalization.
So, what is the overall prognosis? Can horses generally recover well from this?
Generally, yes. The prognosis is pretty good for those simple obstructions that clear up well with flushing.
That's good news.
It gets more guarded, though, for the chronic recurring cases, or ones involving really severe trauma, those complex congenital issues needing big surgery, or if the duct is just permanently damaged. Interestingly, acquired obstructions, the ones that develop later in life, can sometimes be trickier to fully resolve than the congenital ones. Although if the acquired cause is a foreign body or dental disease, and you remove or treat that specific cause, the prognosis is usually better.
Okay.
But if you've got, say, advanced cancer pressing on the duct, or really bad facial fractures, sometimes achieving a permanent fix where the duct works normally, again, just isn't possible.
Right, that makes sense. So, thinking preventatively, is there anything horse owners can do to try and stop this from happening?
Prevention mostly focuses on reducing those risk factors we talked about. Number one is diligent fly control.
Fly masks, repellents.
Exactly. In the barn, in the pasture. Regular deworming is also part of good general health. And then trying to minimize environmental irritants, lots of dust, debris, allergens that could potentially get in the eye and start accumulating in the duct.
So good management, basically.
Good stable management and pasture management, definitely. It can make a difference.
Okay. This has been incredibly informative. It really highlights how complex even seemingly small parts of a horse's anatomy are. Which leads me to a final thought to leave our listeners with. Considering this intricate, almost delicate nature of the equine tear drainage system we've discussed, and the sheer breadth of issues that can disrupt it, from being born with a defect to something as unrelated seeming as a dental abscess, what does this deep dive really teach us about the subtle yet pretty profound ways an animal's environment, and maybe even their genetics, can truly impact their fundamental well-being day to day?
That's a great question to ponder. It really underscores how interconnected everything is, doesn't it?